If you're in need of physical rehabilitation, whether for a sport injury, a work incident, or a chronic condition, and you prefer a practice that uses a one-on-one approach where the patient is always the top priority, then you'll want to check out Fit for Life Physical Therapy. Fit for Life Physical Therapy has been a leader in Florida rehabilitation for nearly 15 years, and with 4 easy-to-reach locations in Gainesville, Ocala, and the Villages in Lady Lake, getting the care you need is not only convenient, it's professional and effective. Shar, I understand that the Fit for Life team has over 150 years combined experience. That's impressive.
Yeah, that's exciting. We have a great staff. I'm excited. We have a great crew.
So what services do you offer here at Fit for Life?
General outpatient orthopedic therapy. We do manual therapy, anything post-operative. We see geriatric. We have vestibular therapy. We have 2 pools on site in our locations, and we also have a certified hand therapist. We treat a lot of spine, foot, ankle, shoulder, knees, balance disorders.
I injured myself surfing. I couldn't raise my left arm above 90 degrees, and as you can see now I can do that. It was important for me to be able to get my mobility back.
Discomfort from pretty much any kind of motion, and I've been here for about 3 sessions, and it's helped me out a lot.
You mentioned manual therapy. What is that exactly?
It's a type of physical therapy where we use our hands to help assist the body heal. We do a lot of soft tissue work, joint mobilization techniques.
How does a patient know if physical therapy is right for them?
Most of the time patients come in by their physician recommendations or referrals. However, we get patients that can come in by themselves, and we also get referrals from employers or from worker comp adjusters.
We have functional capacity evaluations basically to assess them and determine what their functional abilities are and what maybe their limitations are. A full orthopedic evaluation with their strength, range of motion, flexibility, neurological screening, cardiovascular assessment, and material handling assessment, non-material handling tasks as well. Report that back to the physician, and the physician can basically take that information and apply that for the patient to go back to their job or workers' comp.
A lot of what's happening here is a one-on-one approach. Is that typical?
In our practice, yes. In all practices, no. We really strive to spend time with our patients. Each patient has individual needs that we feel like we need to address.
I have a series of exercises which one of the staff works with me to make sure I understand, and they can send home with me so I can do it on a daily basis at home.
One-on-one personal approach that I have gotten here, that presence that they give you, both mentally and physically, I think has really contributed to my success and gains I've made in physical therapy.
Explaining to me the exercises that I needed to do, what they were doing to my muscles, and how I could get to where I needed to get.
You specialize in foot and ankle therapy.
Started foot and ankle 20 years ago. It's just a really important structure in any lower extremity, lower body function.
Your philosophy here is really to empower your patients, to give them the education and the tools they need.
A lot of people feel helpless when they're hurt, and to give them something that they can take home and do for themselves to get better is really important. It helps their recovery and it helps their confidence.
Since I come a couple of times a week, the other days of the week I can use these sheets and go through my program that the therapist has given me at home.
I was able to understand what I had done wrong and what I needed to do right to educate you, to make yourself better, so that you don't have to come back.
If I were to ask what your philosophy is when it comes to physical therapy, what would you say?
I'd like to give my patients back the function they want, whether it walk their dog, spend time with their grandchildren, or return to their sport. And everybody has different goals.
In about 4 weeks, using the exercises that I was given here, I was able to regain my mobility.
It's helped me regain some normalcy in my life.
With what the therapist has done, I'm able to live what I call a happy retired life, and that was what my goal is.